Hi, Mrs. S.E.?
Yes.
Hi, I'm Bill Calder. I'm a family nurse practitioner student with your healthcare team, and I'm going to be performing a health history examination.
Okay.
Is that good?
Yeah, that's
How would you like me to address you?
You can call me Star.
Star? Okay, great. And Star, are you comfortable? Do you need to use the restroom or anything?
No, I'm fine.
Okay, great. What brings you in today?
I'm here for a physical.
For physical? Okay, any other issues?
Well, I am having a lot of shoulder pain, but...
Okay, so physical and you're having some shoulder pain. Can you point to where your shoulder pain is?
Like right up through here.
In the upper part of the arm?
Right.
Okay, and I'm going to be taking some notes as well.
Okay, that's fine.
So it's in your right upper arm.
Mm-hmm.
Can you describe the pain for me?
It just aches really bad, and I have limited range of motion. Like, to try to reach behind me hurts really bad. To try to do my hair and my makeup is really hard.
Okay, how long have you had this pain?
About 2 months.
About 2 months?
Mm-hmm.
So since probably January?
Yes, that's correct.
Okay. And on a scale of 1 to 10, where would you describe this pain being? 10 being the worst, 1 being the least?
Well, during the day, I would say it's about a 6, but by the end of the day and at night, it's a 9.
As the day progresses,
yes.
the pain gets
worse.
Yes.
Yes.
Are you taking anything for this pain?
I take ibuprofen, 800 milligrams 3 times a day.
3 times a day. And does that seem to help it?
Not a lot.
Not a lot? Are you taking anything else besides the ibuprofen?
Sometimes I take Vicodin for pain. I use that more at night.
The Vicodin?
Mm-hmm. I don't take it during the day.
Okay. How much of the Vicodin?
Just 1 tab. I don't know the strength.
Okay, but 1 tab at night before you go to bed.
Yeah.
And then the Motrin, 800 milligrams?
Yes.
3 times a day.
Correct.
And still you're having a significant amount of discomfort.
Yes.
And you describe this discomfort as being an aching pain?
Yes. Except sometimes it's really sharp. It just, like with certain movements, it just hurts really bad.
Okay, okay. So things that would make it worse would be if you're having to move your arm.
Mm-hmm. Yes.
Is there anything that makes it better?
No.
No. Have you worn a splint or anything with the arm?
I tried that for a little while, but it didn't help at all.
That didn't help at all?
If anything, it made it worse.
It made it worse?
Mm-hmm.
Okay. Are there any other things that are associated with this arm pain? You know, difficulty walking, difficulty, breathing, chest pains, any other symptoms associated with the arm? No. Okay. Let's talk about some past medical history.
Okay.
Have you ever been told that you have a medical diagnosis of diabetes, cancer, hypertension, high blood pressure, arthritis?
Yeah, I have arthritis in my hands and my shoulders, and I have hypertension, and I have elevated cholesterol.
Okay. With the arthritis, is it in both shoulders?
Yes, and both wrists.
Both of your wrists.
Mm-hmm.
Do you take anything for the arthritis?
Just the Motrin.
Just the Motrin that you're taking now.
Mm-hmm.
When were you diagnosed with the arthritis?
First about, I'd say about maybe 8 years ago for my hands. The shoulders, I was diagnosed with that just recently in December.
In December of this past year?
Yes.
Okay. And the hypertension? When were you diagnosed with that?
10 years ago.
10 years ago?
Mm-hmm.
And do you take any medication for the hypertension?
I take Maxide.
Maxide. Do you know how much you take?
No, I don't.
No.
I take 1 tab, but I don't know the strength.
You take 1 tab. When do you take that? In the mornings?
In the morning.
In the mornings?
Mm-hmm.
And do you know how your blood pressure has been running?
It's most of the time it's okay. Sometimes it'll go up to like 150/80 or something like that, but most times it's okay.
How often do you check your blood pressure?
Probably once a week.
Once a week? Oh, that's very good. And your cholesterol, are you taking any medication for the cholesterol?
Yes, I take Zocor.
Zocor, do you know how much?
20 milligrams. I take one tab at bedtime.
One tab at bedtime. When were you diagnosed with the high cholesterol?
Oh gosh, probably 10 years ago.
About 10 years ago. And do you know what your cholesterol levels are?
No, I know they had gotten really good, and then I quit taking the medicine for a while because I was worried about the side effects. And then my cholesterol went up really bad, so I started back taking the medicine.
So you quit taking the Zocor. Why did you stop taking the Zocor?
Because I was worried about the side effects of it. One being that it's rhabdomyolysis, I think is what it's called, but it causes a deterioration of the muscles, and I was worried about that. So.
Okay, and so you stopped taking the Zocor, and then through a follow-up visit with your doctor,
correct.
and they checked your cholesterol levels, and your bad cholesterol was elevated.
Yes.
And so you went back to taking the medication.
Yeah. But
Okay.
my triglycerides are usually good.
Oh, very good. Star, do you have any drug allergies or food allergies?
No food allergies, but I'm allergic to all the cillins, like amoxicillin, and I'm allergic to Keflex and Ancef. And I'm also allergic to macrobid.
And macrobid. And what happens if you take any of these medications?
Severe rash.
Severe rash. Is it a local rash?
No, it's all over.
All over. Okay, severe rash. Okay, very good. Star, surgical history, hospitalizations. Have you had any hospitalizations, any surgical procedures?
I had my gallbladder taken out.
Okay. When did you have that done?
I had that taken out in 1991.
1991. Any complications from that?
Yes, I got, when they took the gallbladder out, they always test the gallbladder, and it had Klebsiella, and where they had taken it out leaked into my abdomen, and I had peritonitis.
Okay, and did you spend time in the hospital for the treatment of the peritonitis?
Yeah, they discharged me one day, and the very next day I was admitted back into the hospital, and I was there for 5 days on IV antibiotics, and I was really sick.
What brought you back into the hospital? Was it abdominal pain?
I thought I was going to die.
You just thought
Seriously,
you felt pretty
I
bad.
was very ill, throwing up, hurting really bad, and couldn't keep anything down.
Any problems since then?
No.
No. Okay. Any other hospitalizations?
Yes, I also had a hysterectomy that year.
In 1991?
About 3 months later.
Any complications?
No.
No. Okay. Childhood illnesses. Do you recall having any of the typical childhood illnesses? Chickenpox, measles, mumps?
I had chickenpox, then measles, I had mumps, but that's really all.
Any whooping cough?
No.
Rheumatic fever,
No.
scarlet fever,
No.
polio?
No.
Okay, just the measles, the mumps, and the chickenpox.
Right.
Very good. Your obstetrics, and I know you mentioned in 1991 that you had a hysterectomy. Number of pregnancies?
I had 2.
2. Any miscarriages?
No.
Did you carry both full term?
My son, I had the flu, and I had bronchitis, and I went into labor early, so they put me in the hospital and stopped my labor because they said if he had been born then, he would have been born with the flu and bronchitis, and he was at like 8 months, so they stopped my labor, and they put me on bed rest.
Were you at bed rest at home or in the hospital?
I was in the hospital for about 5 days, and then I was home on bed rest for about 2 or 3 weeks.
Okay, and for your son, Is this the older of the two
Yes.
children?
Mhm.
So your son, how old is he now?
He's 26.
26 years old. So you were at home on bed rest, and did you carry him to full term,
Yes.
to 40 weeks, and then delivered? Any complications with the delivery?
No. Mm-mm.
No. And your other child,
My daughter.
a daughter,
Mhm.
any complications?
No.
And how old is she?
She's 24.
And 24. Okay, very good. Did either one of your children weigh over 9 pounds?
No.
Okay, very good. Mammograms. Have you had a mammogram this year?
I haven't had one this year. I had one last year.
You had one last year?
It was negative.
It was negative.
Mhm.
How about pap smear?
I had a pap smear last year too, and that was also negative.
Okay, very good, very good. Recent health examinations, dental. You've been to the dentist this year?
Yes, I have. January.
In January? And any significant findings?
They just replaced a crown is all.
Okay,
And
replace
clean
the
my
crown.
teeth.
No other dental problems?
Oh well, I do grit my teeth a lot, mostly in my sleep, and so it causes fractures in your teeth. So I'm probably going to end up having more crowns. So.
Okay, do you wear a guard
Yes.
at night
Mhm.
to help you stop
Right.
the grinding of the teeth?
Right.
Okay, how's that going for you?
It's going better. At first, I didn't want to wear it because it was not comfortable, but it's better.
And do you see your dentist every 6 months?
Yes.
Okay, very good. And vision. Any problems with your vision?
No, I mean it's hard. I have more difficulty with up close than I do distance. I wear contact lenses, and when I'm not wearing contacts, I have prescription glasses.
Okay, and when was the last time you went to your eye doctor?
January.
In January?
Mhm.
Okay, very good. And so your prescription, you have your contacts and you have your eyeglasses. Any chest x-rays?
Not recently.
Do you remember the last time you had a chest x-ray?
Not really.
Okay. How about EKGs or ECGs, any heart monitoring?
I've had heart monitoring because my sister died of a heart attack and my dad did too, and my mom had open heart surgery and congestive heart failure. So they've done all those tests, but mine were all good.
Okay, very good. Now we mentioned some of your medications, the Zocor for your cholesterol, your Maxi for your hypertension, and the ibuprofen, and then the occasional Vicodin. Are there any other medications that you're taking? Any over-the-counter medications?
I take supplements. I take vitamin E, fish oil, and CoQ10, multivitamin.
And a multivitamin. Do you take those every day?
Yes.
Okay, very good. Any herbal medications?
No. Mm-mm.
Okay, very good. Immunizations. Have you had your flu shot this past year?
No, I didn't get a flu shot
No.
this past year. I normally do, but this
This year you skipped out?
well, they gave it on a day at where I work. They gave it, and I was off that day. So
Okay. How about tetanus?
I'm up to date on my tetanus shot.
Do you remember when you had your tetanus shot?
It's been less than 5 years ago.
Okay. Hepatitis B vaccination?
Yeah, I've had that. Yes, and I had my titer checked about 2 years ago, and it was still good. So.
Okay, very good. Pneumococcal vaccination?
No, I haven't had that.
Tuberculosis screening?
I've had that. Due again this month, though.
It's due this month. Okay, your prior testings, were they negative?
Yes.
Okay, very good. Family history. Many diseases have a genetic component, and the purpose of the family history is so that we can better gauge risk factors. So let me ask you about your cultural background or ethnicity.
Okay. I am part American Indian and Irish, and Scottish and English.
Oh, very nice, very nice. And are your parents living?
No.
No. Your father, what did he die from?
A heart attack.
A heart attack? And how old was he?
69.
69? And your mother?
My mother died of congestive heart failure, and she was 74.
74. And your grandparents?
My grandparents on my mom's side, like my grandfather died of diabetes and heart disease, and my grandmother died from Alzheimer's. And on my father's side, my grandfather died of a heart attack, and my other grandmother died of Alzheimer's.
Do you recall the ages of your grandparents?
Well, I know on my mother's side, they both died pretty young. Like, I think my grandfather was in his upper 60s, and my grandmother too. On my daddy's side, my grandfather died very young. He was like 50. And my grandmother, though, she lived to be in her, I think, 80s.
Okay, very good. Thank you. And your children are alive and well?
Yes.
Any other family relatives, close relatives that have passed away?
Yes. My sister died of a heart attack when she was 54. And
So
she's
young.
been dead for 2 years.
Thank you. Let's talk a little bit about social history.
Okay.
Can you tell me what type of education you have?
I have a college education. I'm a nurse by profession. And about a couple years ago, I became an administrator for assisted living.
Oh, very good, very good. So you work as an executive director
Yes.
in an assisted living facility.
Yes, I do.
Very good. How is that? Do you like that type of work?
Love it.
You
Love
do?
it.
Good, good.
Yeah, I love working with
I
the
can imagine that
elderly.
would be very challenging.
It is, but it's
But very
very
rewarding.
rewarding. I
Very
love
good.
it.
Can you tell me about your living arrangements?
I'm married. My husband and I have been married for 30 years, and we've got we own our own house, and you know we live in a nice neighborhood.
Okay, very good. And Star, what do you do for relaxation or hobbies?
I like to in the summer and the spring. My husband and I like to go bike riding and walk. I love to read, so that's something that I do a lot, is read.
Very nice, very nice. Let's talk about some dietary habits. You
Okay.
mentioned about the high blood pressure and the cholesterol.
Mhm.
So, a normal day of your dietary
Mhm.
habits, you know, breakfast, lunch,
Mhm.
dinner, snacking.
Right.
Can you tell me a little bit about
I
that?
try to watch what I eat. Like most times for breakfast, I'll eat like oatmeal with raspberries, or I might get like an egg white omelet or something like that with wheat English muffins. For lunch, you know, I try to watch what I eat. Sometimes it's challenging at work and stuff, so I usually have like Weight Watcher meals, or I'll have salads or things like that.
Okay.
For dinner, I cook most of the time, you know, but I try to make sure it's fairly healthy.
Okay, very good. Do you smoke?
No.
No, very good. Do you consume alcohol?
Occasionally, you know, socially, I don't drink even once a week, so, you know, not
And
that often.
when you do socially, what type of alcohol do you drink?
Usually wine.
Wine.
Mhm.
And how many glasses of wine would you have?
Like maybe 2.
Maybe 2 glasses of wine.
Mhm.
How about your sleep patterns?
Sometimes I have some difficulty sleeping. I usually take melatonin at night, and if I'm having trouble other than that, I might take a Tylenol PM or something.
The melatonin, do you know how many milligrams you take?
10 milligrams.
10 milligrams.
Mhm.
How often do you have difficulty getting to sleep, where you will take the melatonin?
I take melatonin every night, so it helps me to sleep. But occasionally I still have some problems, so maybe, a couple of times a month, maybe.
Okay. With the Tylenol PM?
Yes.
Okay. Well, thank you, Star. You've given me some really good information, and I appreciate that. Let's just go over a brief review of systems, and you just tell me, how you feel about these. Your general health, and I know you've mentioned your right arm being painful, and the arthritis in your other shoulder, as well as in your hands, and you mentioned about the hypertension and the cholesterol, and a little difficulty in sleeping on occasions, and we've gone over your medications. But overall, how would you generalize your overall health? Fair, poor, good, very good?
I would say good.
Good. Okay, very good. Memory. Any memory loss? No. Any headaches?
Occasional.
An occasional headache. And how often would you say a headache? Occasional.
Maybe a couple times a week, something like that.
A couple times a week. Have you seen your doctor about these headaches?
Yes, I have.
And what has he said?
He didn't think it was anything serious,
No. Do you take any medications for these headaches?
Just the ibuprofen helps, or I might take some Tylenol.
Okay. The headaches, can you describe where these headaches are?
I guess more in the front.
In the front of, okay. And the medication, if you take the Tylenol or the ibuprofen, the Motrin, does it help to relieve the headache?
Yes.
Okay, very good. Any seizures?
No.
Tremors? Tingliness?
No.
Any depression?
No.
And you mentioned that you wear glasses and contacts.
Yes.
Any other problems with your vision or with your eyes?
No.
Okay. Hearing? Any problems with hearing?
No.
Very good. Cardiac? Any chest pain, shortness of breath,
No.
edema,
No.
palpitations,
No.
chest beating?
Yeah.
Any respiratory shortness of breath? Any cough?
No.
No. Very good. Gastrointestinal? Any problems swallowing?
No.
Problems with bowel movements?
No.
Any sour stomach? Belching?
No.
Burning? Throat irritation?
No.
Hemorrhoids?
No.
Urinary? Any problems with voiding?
No.
Very good. Musculoskeletal, you've mentioned, about the joint discomfort, but any other joint discomfort?
No.
Any other edema or any edema?
No.
Very good. And range of motion, I know that you had mentioned some difficulty with range of motion of your right arm. Any other limbs where you're having difficulty with range of motion?
Yeah, my left arm.
Your left arm. With your left arm, is it, are you able to raise your arm out? Where is the limited range of motion?
It's just that it just hurts sometimes if you move back or just different things. Different ways I move sometimes it hurts.
It's more in the joint of the arm here, not here.
Right.
Okay, very good. Skin, hair, nails, any bruising,
No.
any rashes, dry skin, any unusual moles, anything like that?
No.
Very good. Any recent weight loss or weight gain?
No.
No. Okay. Well, Star, thank you very much for all the information that you've given me. This information will become part of your medical record. It is completely confidential, and this will enable your healthcare team to better meet your healthcare needs. So I want to thank you for your time today. Do you have any questions for me?
No.
Okay,
Thank
great.
you.
Well, it's been a pleasure.
Yes.
It's been a pleasure. And that concludes our health history interview. Thank you.